I'm Ian Meredith. I'm the Professor and Director of MonashHeart, Monash Medical Centre, and I'm also the Professor of Cardiology at Monash University in Melbourne. I'm also the Executive Director of the Monash Cardiovascular Research Centre here at Monash Medical Centre. Well, MonashHeart is an exciting cross-campus cardiovascular medicine service that provides state-of-the-art clinical cardiology for the southeastern community of Melbourne. It is a very cohesive, collaborative service that was born out of the original cardiology service here at Monash Medical Centre. We've had cardiology services here at Monash Medical Centre since the hospital was opened in 1987. The initial and pioneering professor and director was Professor Richard Harper. He led the services right through till 2005. In 2005 we took a new direction though to create a truly cross-campus collegial service that embraced all of the assets of Monash Medical Centre at all of the other sites, namely Dandenong and Casey Hospital, and in the future at Moorabbin Hospital. And we renamed the service MonashHeart to embrace those collegial, collaborative, cohesive aspects of the service that we had here that we wanted to roll out across the entire network. The strengths of MonashHeart is that we're truly a multidisciplinary service with excellence in every area of cardiovascular medicine. We have excellent non-invasive imaging, we have state-of-the-art interventional cardiology services performing world-class services with first-in-man clinical trials. We're well represented on the world stage with our clinical research program. Not only do we have wonderful interventional cardiology services and non-invasive imaging led by experts, but we also have a wonderful electrophysiology program with true leaders in the electrophysiology performing state-of-the-art techniques. We're at the forefront of many of the new innovations in radiofrequency ablation for atrial arrhythmias and ablation of ventricular arrhythmias. And we also have a very exciting program now with the Watchman device to occlude the left atrial appendage in patients with atrial fibrillation who are not suitable for long-term anticoagulation. Now that is a typical example of the sort of things that we do here. We certainly are at the cutting edge of clinical services. Although we're providing excellent general clinical care in cardiology, we have some wonderful programs leading us into the future in both interventional cardiology and electrophysiology. So more recently we acquired a state-of-the-art 320 slice CT scanner that enabled us to do high resolution full volume coronary CT angiography, and we've started an amazing program for the rapid triage and assessment of patients with chest pain in the emergency room. Now across Southern Health we have more than 5,000 patients a year who present with chest pain syndromes, and all of these patients require careful evaluation and consideration of whether they need admission to hospital or whether they're safe for discharge. The CT scanner has provided us an unparalleled opportunity to investigate patients in a very timely and efficient way to look at their coronary arteries in detail, non-invasively, and allow us to decide whether they need to be admitted to hospital or whether it is safe for them to be discharged. This is one of the new and exciting programs we have. One of the most interesting things about MonashHeart is that we can actually provide cardiovascular services from early childhood, in fact in utero, right through to the end of life, because we have a vertically integrated service that provides not only fetal cardiology but also pediatric and adolescent cardiology, and we have an excellent program in adolescent and pediatric cardiology ably run by Dr. Sarah Hope, our pediatric cardiologist. So I think we are world class and I think we have great national and international leadership capabilities in every one of our disciplines. One of the other strengths of our department is our commitment to clinical and basic research. We have, through the Monash Cardiovascular Research Centre, which is a recognised university centre, a strong program in both clinical and basic research. The program is led by Professor Jim Cameron, who is the Director of Monash Cardiovascular Research Centre. He assists and facilitates clinical research in a number of areas, not only interventional cardiology, non-invasive imaging, but also in more important fields such as atherobiology and arterial mechanics, which gives us some insight into the basis of atherosclerosis, which of course is the major disease that affects most of us in the community. In the future, we hope that MonashHeart will become a very powerful, recognised brand both nationally and internationally. We hope that it'll be something that every patient and person in the community will be proud of for our clinical accomplishments. We see ourselves as leaders not only in patient care but also in clinical research and clinical education. We see ourselves as a national leader in clinical education, not only for physicians but also for nurses and members of the allied health community as well, as we feel that we can make a major contribution on how cardiovascular care is delivered both nationally and internationally, as well as looking after our local community.